Hi, I'm Dr. Barry Belton of Doctors Belton and Shrimper, and I want to spend a few minutes talking to you about sleep apnea. Sleep apnea, or obstructed sleep apnea, is what you normally would hear, is an issue where you stop breathing at night. It affects almost 80 million Americans, and very much it's untreated in this day and age. The first line of defense for treating sleep apnea is a CPAP, and most people are familiar with a CPAP, which is a mask that goes over your mouth or your nose, blows air in, keeps your airway open. Unfortunately, the success rate on CPAP is about 25%, so that's where we come in. If you can't or won't wear a CPAP, then your dentist can help you with an oral appliance. An oral appliance pulls your lower jaw forward, which holds your airway open and allows you to breathe. Am I a candidate, or do I need an oral appliance? Do I have sleep apnea? The things that you can look for are tiredness during the day. You wake up tired, you're tired during the day. You can sit down to watch a movie at night, you fall asleep. You ride in the car, you fall asleep. Heavy snorers are good candidates for it. Most males over the age of 50 with a bigger than an 18-inch neck, almost all of them have some kind of sleep apnea. Females, it's over 17-inch neck. So if you fit in those categories, it's definitely you need to get screened for sleep apnea. Your dentist can do that for you, or your physician can do that for you. Once you think that we've been screened for our sleep apnea, you have to have a sleep test. That can be done by your physician, or actually we can facilitate that. And the nice thing about sleep testing now is mostly home sleep testing. If you are a candidate for an oral appliance, they'll let you know. An oral appliance essentially fits over your upper and lower teeth, pulls your lower jaw forward and holds it forward in that position while you sleep. The issue is when you lay down, obviously we relax, the tongue falls back, closes off the airway, and we quit breathing. So this will stop that process and allow you to breathe more effectively, give you much more energy, make you feel better, and there's a lot of health risks for untreated sleep apnea. So it's well worth getting at least screened and know whether this is an issue for you. So if you think you may have sleep apnea, then it's time to talk to somebody about it. Either your physician or your dentist, someone can talk to you about it. We would be glad to talk to you. We do consultations for free to discuss the issues. We can set you up with sleep testing to find out whether you have sleep apnea or not. He said one of the biggest signs is heavy snorers. I don't know how many families I've treated that they sleep in separate bedrooms. We've solved a lot of those issues, a lot of success with that. So if those issues are something you have, then we would be glad to talk to you. You can call our office. Amy's our sleep specialist. She will talk to you, do a free consultation with you, walk you through the process. The nice thing about this is we're going to hold your hand through the whole process. We're going to get you the sleep test. We're going to do it. It's a medical device. It goes on your medical insurance. We'll work with you with your medical insurance in order to get the payment for it. It's a seamless process, but it's something that I think is very important that we need to address. So we just want you to have a good night's sleep.